Assalamualaikum warahmatullahi wabarakatuh. How are you everyone? And our lecture today is the common complication and emergency drug use in the theater. اختاريت lecture. It's quite different. It's quite useful related to our work in the theater or in the ICU. So the common complication and the emergency drug use in the theater. So what are we going to use in that way? Let's move to our outline. Our outline today is the introduction, the concept of golden hour, وراح نركز على هذا الموضوع concept of golden hour, and name a drug that you should be present all emergency tray or every department in the hospital. شنو الأدوية اللي ممكن نوفرها as an emergency in every tray, in every cabinet, in emergency department in the hospital, and the drug for respiratory emergencies. اختاريت respiratory as we gonna deal with the respiratory system. احنا كتخدير نتعامل ويا respiratory more than anything else. Let's move to the introduction. Emergency medicine is the medical specialty. كل الemergency هو medical specialty dictated to diagnose and treatment of unforeseen illness or injury. هذا هو تعريف emergency medicine. هو عبارة عن medical specialty يخصص ل diagnosis and treatment of unforeseen illness or injury. Emergency drugs are those chemical entitled used in the patient during life-threatening condition. So هي عبارة عن emergency drug. الأدوية الطوارئ هي عبارة عن chemical entitled used in the patient during life-threatening condition so that his symptom can be controlled and life can be saved. هي عبارة عن تسيطر على symptoms and على life. Emergency drugs are usually available in those kind of doses form which have short onset of action for rapid effect. هي عبارة عن لها تأثير سريع وفعال. As you know, we're gonna deal with the emergency. The concept of golden hour. شو نقصد هنا بالgolden hour؟ الgolden hour هي لما ما تستلم مريض and how we gonna deal with him or her within an hour to save her, she or his life. So in emergency medicine احنا نتعامل أيضا مع emergency. The golden hour, also known the golden time, refer to a time period lasting for 1 hour or less following a trauma injury being sustained by casualty of medical emergency, which is there is highest likelihood that prompt medical treatment will be prevent death. هي emergency medicine بالgolden hour. How we gonna deal with the patient within an hour or less to save their life during the trauma patient. يعني بيجيك مريض مصاب شلون تتعامل وياه within an hour or less to save their life. It's well established that patient chances of survival are greatest and they receive care within short period of time after a severe injury. يعني راح تتعامل وياه خلال هالساعة be smart enough and we're gonna deal with the patient in the ideal way and it could be save their life. هاي نقصد بالgolden hour. So the golden hour من المواضيع المهمة بالemergency to save the patient's life. emergency management شنو هذا chart بسيط يوضح شنو emergency management اللي هي ABCD اللي هي emergency airway. وشنو نسوي airway؟ هي patient give airway support if needed breathing be breathing respiratory rate oxygen saturation and give oxygen. circulation اللي نقصد بها heart rate blood pressure capillary flow IV access and bleeding. disability head injury infection bleeding treatment أو temperature body mass index. So هذا نقصد بهذا الشارت فيما يخص emergency management واللي هي ABC and everyone should know it very well. Name a drug that should be presented all emergency tray of emergency department hospital الأدوية اللي ممكن نوفرها في كل emergency department. وش نقصد بها؟ شنو البيربس منها؟ شنو الغرض من هذا الموضوع؟ To provide initial treatment for both spectrum of illness and injury and most which are life-threatening. So broad spectrum of treatment to save life of patients, to control symptom of patients, to reach the side action as soon as possible, to reach the side of action as soon as possible, to normalize the vital body function و to diverge the patient from possible risk. هي عبارة عن هذا البيربس مالتها، هي save the patient life in different ways. الأكسجين شنو البيربس مال الأكسجين فيما يخص emergency medicine؟ So without auto brain death occur within 6 minutes، يعني خلال 6 دقائق. إذا brain without auto could be brain death occur within 6 minutes. Oxygen saturation is measured using pulse oximeter. Emergency condition, oxygen is required for severe physiological stress, in shock, traumatic injury, acute myocardial infarction, cardiac arrest. Oxygen delivered using nasal mask or intranasal catheter. It's delivered through the nasal cannula. Rate 1 إلى 4 لتر minimum 24%. Through face mask the rate is 5 to 10 liter per minute. Oxygen is titrated according to the SpO2. Caution in case of COPD, as they may lose their hypoxic respiratory drive. So هذا caution in case of the chronic obstructive pulmonary disease patients, as they may lose their hypoxic respiratory drive. هذا في مخزن الأكسجين. So which is one of the important things in emergency patient. drugs for respiratory emergency. شنو هي الدراج اللي نستخدمها بالرespiratory emergency؟ بالأسماء as a chronic inflammatory disease of airway of the lung. Status asthmatic is an emergency condition which is attack not delivered by the bronchodilator. نستخدم السالبوتامول واللي حاكي لك more details عليه شلون يسوي smoothing للmuscle relaxation، هو بيتا 2 antagonist. والكيس اوف acute asthma قد نستخدم الدوز مال السالبوتامول. و شنو الانديكيشن for using the salbutamol in the asthmatic patient. الهيدروكورتيزون شنو نستخدم الهيدروكورتيزون؟ ايش قد الدوز مالته 200 ملغ IV immediately. وشنو اللي هو يعتبر من الاستيرويد والشورت اكتنج استيرويد واللي ممكن تشتغل على اساسه. هيدروكورتيزون الادويه اللي نستخدمها بالريسبيراتوري اللي عباره عن سالبوتامول، هيدروكورتيزون، والامينوفيلين. So if we get back in there, so aminophylline هذا من الادويه تستخدم فيما يخص الاسمى. So هذا فيما يخص الأسمى، فيما يخص الدراج اللي يستخدم using for the respiratory system. والexaspiration of the chronic obstructive airway disorder أيضا نستخدم السالبوتامول، نستخدم الهيدروكورتيزون and aminophylline given. So هي من الأدوية اللي تستخدم أيضا in both ways to treat the patient with respiratory distress or respiratory symptoms. البيجلوتايتس مش نستخدم لها. البيجلوتايتس نستخدم بورد سبيكتروم انتيبايوتيك واللي هو السيفوتاكسين. الدوز مالته 100 ملغ بالكي جي اي بي immediately. pulmonary edema هي واحدة من الأشياء المهمة اللي عندنا. pulmonary edema نستخدم بالأكيوت. pulmonary edema is a medical emergency that require prompt treatment. So oxygen, morphine, vasodilator and diuretic should be used. So oxygen, morphine, vasodilator and should be used. الفيرسمايد هو طبعا الدوز مالته نستخدم مورفين، نستخدم دوز مال دوبامين دوبيتامين، ومورفين دوز اي في to reduce anxiety and dyspnea. هذا فيما يخص الاشياء اللي drug use in the respiratory system. اختارنا الاسمى، اختارنا الكرونيك obstructive pulmonary disorders، اختارنا الابيجلوتايتس، واختارنا البلمونري edema. So that's the end of our lecture today. It's quite simple and it's quite very short, brief things that should given to you guys, and hopefully it's useful for you guys. And please don't hesitate to send me your questions and any comment, any feedback, and I'm more than happy to answer it. Thank you for the listening, and we'll see you guys in the next lecture. Thank you.